Need surgery? No health insurance? If you do not have health insurance, but you are in need of decompression surgery, try these possible options. Check to see if your neurosurgeon's connecting hospital has an in-house financial assistance program. Some hospitals have their own insurance programs that you may qualify for. Check and see if the hospital will negotiate or offer lower rates for uninsured patients. Also, try contacting your local Medicaid office to see if you qualify for a low-income-based program. Sign up for a fundraising platform such as Spot Fund or GoFundMe. My prayer is that some of these resources will help you get the services needed for a better quality of life. Be blessed. What questions should I ask my neurosurgeon if decompression surgery is recommended? You are your best advocate. A good neurosurgeon should welcome your questions and answer them clearly. Understanding your condition. What type of Chiari malformation do I have? Type 1, type 2? How severe is my herniation, and how is it affecting my brain and spinal cord? Are there any signs of syringomyelia, hydrocephalus, or other complications? Are the symptoms I'm experiencing directly related to Chiari malformation? Surgical details. What exactly will be done during decompression surgery? Will you perform a bone-only decompression, duroplasty, remove part of my cerebellar tonsils, or remove a portion of C1 and C2 of the spine? Why do you recommend this specific approach for me? What type of dural graft will be used? Synthetic? Animal skin? Risks and outcomes. What are the risks and potential complications of the surgery? Infection, CSF leak, nerve damage? What is the success rate for this surgery in patients like me? What symptomatic improvements should I realistically expect? Are any of my symptoms unlikely to improve or potentially worsen after surgery? Could this condition or the syrinx, if present, reoccur after surgery? Recovery and follow-up. What is the typical recovery time? How many days will I be in the hospital? What kind of pain or discomfort should I expect during recovery? When can I start back driving, return to work, exercise, or resume daily activities? Is physical therapy recommended after surgery? What ifs? Is there a chance this could be a genetic condition? If so, should my family be screened? Are there any non-surgical alternatives that could still help me? What happens if I choose not to have surgery right now? Have I had all the necessary imaging, like a full spine MRI, to rule out associated issues? Surgeon inquiries. How experienced are you with Chiari decompression surgeries? What should I do to prepare for surgery? And feel free to get a second opinion if need be. Congratulations, you got this. What questions? Considering decompression surgery, make sure you get these questions answered by your neurosurgeon. What pre-op tests need to be completed before surgery? Are there any medications I should stop taking prior to surgery? How long does a procedure like this normally take? What is the surgery process? What is the expected hospital stay? What type of material will be used for the Dura patch? How much of my hair will be shaved during this procedure? Who will be involved in my care in the operating room? What pain medications or antibiotics will be administered? Will stitches or staples be used to close my incision? What is my expected recovery time, and what does that process look like? When will I be able to start back driving? When will I be able to return to work? Will there be any post-surgery restrictions? Will I need to have any follow-up tests or MRIs after my surgery? What type of anesthesia will be used and how will it be administered? What medications will I be sent home with? Just a quick tip, try to avoid scheduling your procedure on a Friday when there is a possibility of staffing shortages. Also, try to schedule your procedure earlier in the year. After you have met your deductible, your health insurance will begin to pay a larger share of your medical costs. Once you've healed, this is an excellent time to schedule any other special visits or elective surgeries while your costs are lower. Are there any post-surgery instructions or things I need to know for recovery at home? Speak with your neurosurgeon about any other questions you may have, and just know you got this. Here are a few tips to help you prepare for your hospital stay. First off, I'd like to say congratulations, as your best days are yet to come. Deep cleaning the home in advance is a great idea while you still have the energy, because once you get home from surgery, you'll need to rest. Meal prepping in advance is also ideal. That way, if you are home alone, you won't have to worry about meals from day to day, and you'll have something readily available to eat. Think about bringing your favorite snack or protein drinks with you, as the medication can sometimes hinder the appetite. I would definitely pack a long cell phone charging cord or power bank, because sometimes the beds are away from the wall plug. Of course, bring your toiletries, toothpaste, toothbrush, mouthwash, deodorant, and feminine products if need be. I would definitely think about bringing maybe a front button-down shirt, or at least loose clothing that's easy to get on and off. And for me, I just wore the hospital gown that was comfortable with my pajama pants underneath. Even though I brought tons of stuff, this worked out because I was comfortable. You might want to think about bringing some house shoes just in case. I was given non-slip socks at the hospital, and that worked. I would definitely make sure that the pharmacy has your medication readily available. That way you can have someone pick it up before you arrive home, because you're definitely going to need it. Once home, I would try to eat some high fiber meals to kind of ward off the constipation that may happen regarding the medication. And yes, relax. Do something fun the night before surgery. Enjoy yourself, because tomorrow is a new day. And of course, take a deep breath and get you some sleep. Get you some sleep. You got this.
Hey y'all, so today's Chiari conversation is about the much needed necessities when you return home from surgery. Majority of these things you can find on Amazon, and it would behoove you to go ahead and purchase them in advance. That way you can have everything set up. These are just some of the things that helped me out when I came home, because at minimum that first week, as you know, with any other surgery, that's going to be rough. So I just wanted to give a few tips for things that really helped me out. So I'm going to just go through my little list here. All right. So first things first, at the hospital, they want you to lay back, but it's really kind of hard because of the pain, and whether you have staples or sutures, laying back on your head is painful. So what they had me do was we'll just use this for example, to roll up a towel, because I could not get comfortable for the life of me. So they rolled up a towel for me, and they had me to put it around my neck, and then I lay down on the bed, because for me, I could not lay back. They wanted you to sit up like this and lay back, but I couldn't do it. So they gave me a towel, and I was able to kind of use that as, a means to not lay on the back of my head, but still try to get some comfort. So having a towel rolled up at the hospital is handy. When you get home, if you have a recliner, that is ideal. Trying to lay in the bed for me was not working, unless I had my pregnancy pillow. But I had a comfy recliner, a comfy recliner, and I was able to just kind of lean back and lay my head to the side, which was much more comfortable than laying in the bed. If you don't have the type of shower where it has like the little bench already in it, I suggest maybe getting you a cheap shower chair, because when you return home, it's really hard to stand. For me, it was. Now, mind you, I'm not a doctor, so I'm only telling you guys my experience. May not be yours, but it's mine. So, shower chair. I was not able to stand up for very long because of the pressure and the pain in my head, of course the pain from the surgery itself. So grab you a shower chair, or at least maybe if you have a bench in the shower, you can set a towel down on it and kind of wet the towel, set it down so it's not cold, but also so you don't slip. Because for me, it was really hard to stand up, and it just didn't work out. Shower head. I'm going to show you guys a video in a minute of this shower head I purchased off of Amazon, and I had this before my surgery, and it's detachable. It's detachable, and I was able to, sit down and literally, wash my body and rinse off. All right. So that shower head worked out really good. So that was a plus. I got these cups right here, these disposable cups off of Amazon, because one thing I was not able to do when, you're trying to rinse your mouth and you're brushing your teeth, I was not able to bend my head forward because it hurt so bad. The pressure of moving made it worse. So what I did was, we'll pretend like this is a toothbrush. When I brushed my teeth, I spat in this cup, and then I got the water and rinsed with this cup and then spit. And that helps to where you're not having to bend your head down, because like I just stated, the pressure from that, So brushing teeth, and then using the water, rinsing. And I think I even was brushing my teeth in my bed, and then once I had the water to rinse my mouth out, I was able to just, spit in the cup. So I suggest maybe you get some of these disposable cups. That way you can trash them when you're done. And these are on Amazon for pretty cheap, so you can get like a whole pack of those. So that's my suggestion on that. Vomit bag. I was introduced to these at the hospital. Had no idea. Wish I'd have known before even the surgery, because I had the issues with vomiting, so I would have to just run to the bathroom. And so anyway, they introduced these to me at the hospital. You can get these on Amazon for cheap. It comes in like a bulk pack, but it's literally a bag. Can you guys see this? This is the brand that I got on Amazon. But yeah, it's literally a bag, and these helped me out so much at the hospital. I didn't have to get up. I probably regurgitated multiple times the first few days, and I was just able to do like this, take care of my business, did it like this, and then I passed it to the nurse and she disposed of it. But here at home, this comes in handy. It even gives you the instructions on how to use it. Not that we need to measure the amount of vomit, but it's really good. I even keep these in the car. You know, you can keep these in your glove box, in your center console. It's really good to have on hand. I don't know, maybe somebody's having motion sickness or something, but these are really good for those of you guys who have nausea issues. Speaking of nausea, I'm trying to make sure I'm on my list right. Speaking of nausea, I already knew about this life hack, but also learned about it, was reminded about it in the hospital. These are alcohol pads. And so when I was in the hospital with all this vomiting that I was doing with these bags, the nurse reminded me that if you just open the alcohol pad and take a whiff, it helps to alleviate nausea, and that works. So maybe try that if you have bad nausea in the hospital or when you get home. These come in handy. I bought this box on Amazon, like I said, for cheap, so look into getting some alcohol pads in addition to the vomit bag, which is really good. I should have had this a long time ago, but I just got this off of Amazon. This neat little reacher. I want to say it was maybe, I don't know, it was under $10. And this one is pretty good. I don't know how to do it, but let's see here. Yeah, it's well, so anyway, it collapses like this. And so, because with me, I still have issues with my throat. So this thing is really good from having to pick up stuff off the floor. And it holds great. So if you can, get your reacher for the house, at least for sure. If you're at home, hopefully you're not, you know, having to be at home alone for the first week. But if you're needing to pick up stuff, because like I said, the pressure of having to lean over, yeah, it's not good. So try your best not to have to do motions, quick motions. So this reacher, like I said, comes in handy for that. Constipation. Not sure what medication you'll be taking. I had hydrocodone and some type of vomit medication, and I think I had some muscle relaxers. Yeah. So, you know, taking all those medications sometimes, and like I said, I'm not a doctor, but sometimes those medications will cause constipation. So do your research, but you can find this Napalina flaxseed oil, not oil, Napalina flaxseed fiber. You can find it on Amazon. They have it at Walgreens. They have it at, I can't even think of the other store right now, but they have it. And so basically, it's just flakes. I'll just show you a little bit. All right. So, Napalina. So it's just flakes, if you guys can see that. It's literally like bird seed. You can put that on some oatmeal. Yeah, I would suggest putting it maybe on a salad, or you can mix it in, like right here, you can mix it in some juice. So that's good. And just make sure you read the instructions, because it has, I believe it has senna in it. And it really makes you go to the bathroom, so take your time with it. Okay. Appetite loss. In the hospital, I did not have much of an appetite. Could not eat even when I got home. But what I do know is that even before surgery, when I needed help with my appetite, fish oil, please Google, and look it up for yourself just in case you're taking other medications. But I know for sure that fish oil increases your appetite. So this actually works. Like if I know I'm like, okay, I'm not very hungry, I kind of take this, and after a while I'm like, okay, now it's time to eat. So fish oil works for appetite issues if you need help with your appetite while you're trying to heal. I spoke about my pregnancy pillow. I went on Amazon, and I'll probably throw up a picture, but I went on Amazon and I had this thing for probably years. It's a C-shaped pillow that you can lay in the bed with you, and it's good if you have to lay on your side. It also helps with maybe like the pressure on your back, because you can ease the pillow, and you can wrap your legs around it. The C-shaped pillow, you can wrap your legs around it, and that'll help. I don't know if I used it so much the first week, but thereafter I did, because the recliner is comfortable but may not be as comfortable as laying in your bed. So the C-shaped pillow really helps, moving forward, if you want to still be able to lay in your bed comfortably without having to lay on your incision. Okay. Another thing is decompression socks. I know at the hospital, they had me put my legs in this thing that was squeezing my legs like this to get the circulation going, in addition to me walking around. But decompression socks work for that. It's a good idea in theory, but I can't do it for too long because the tightness on my legs. So maybe you can stand the decompression socks, but I just don't like that constricted feeling. So for me, I just started doing a more slow walking around the house, because what I did notice is that when I got home, it's like, I guess I had been laying for so long, my butt, my legs started hurting really bad. And it was just, didn't realize you cannot lay down for too long. You actually have to get up and, help your legs with the circulation by just taking slow steps around, not doing too much, but taking slow steps around, kind of like, they had me to do at the hospital, so that you don't have to worry about, possibly getting blood clots or anything else going on. So, let's see here. These, for me, like I said in some of my videos, my ears, when I got home, it was like I had Superman hearing, and everything was so loud. And so I purchased these soft touch bumpers. I don't know if you can see that. I got these on Amazon. And so these are for the cabinets. Now, you guys may have these already on your cabinets, but for the rest of us, where they came off. But these things right here, they peel off. I don't know if you can see that. They peel off. There we go. They peel off and they stick to the cabinet. So when you close the cabinet, it's not loud, because I've got a bunch of kids, and when they started closing cabinets, I'm just like, it was excruciating. So I got these and put them on the cabinet. So when they started closing them, I was able to better cope with the noise level. So if you're interested, I got these on Amazon. Everything I got on here was pretty cheap, but these bumper cabinet things work really good for that. You may not have this problem though. And then, speaking of Superman hearing, foam earplugs. You probably won't need this many. I think I just got them in bulk, because it might have been like $10 or something. But at least for the first week, I had to walk around with these in, because I was still having the tinnitus after surgery. So, and then I guess because the removal of the bone, the skull, it's almost like my head was hollow. So it took time for my hearing to adjust. So like I said, I was so sensitive. Even when I went out, which I didn't go out much, but when I did, everything was just so loud and amplified. So I would get these right here and put them in my ears. And so while my kids are in here doing stuff, I can better, rest, because I'm not having to hear all these loud noises. So these worked out really good. I even wore these to bed, not in both ears, because I need to be able to hear, but I would put, in the ear that seemed a little louder, which I think was this one. But at any rate, these things work right here. So you might want to think about getting you some of these. I'm sure they have them at Walgreens or anywhere else. You can probably get less than this right here, but these earplugs work really good with the sensitivity after you return home from surgery. Okay, what else? I think this right here, not for the first few days, but maybe the second week after you arrive home, this is really good, because you know, you're still gonna have that pain, but after you kind of heal up in the back, so this part is not as much hurting or whatever. But this right here worked, because it's like my neck, it was still like in a painful stiff mode, and it was restless. And you know, sometimes for me when I came home from surgery, it was just hard to sit my neck up. So it was easier for me to just put this little neck pillow on. You know, they have these if you guys go like on airplanes or whatever. They have them at Walgreens, they have them on Amazon. But for me, without touching the back of my head, just me being able to rest my neck while I was sitting in bed was very helpful, because my neck was super restless, like, you know. And so this thing right here really helped out with that, this neck pillow. And you can buy them on Amazon. They have different ones. This one it's not too firm, but it's not too soft, but it really gave my neck some support. And then I want to talk about this right here. I'll do a separate video about my hypertrophic scarring, but if you're prone to keloids or anything like that, or if you have a cut or something and, you know, that extra skin comes on there, then there's a possibility, I'm not a doctor, but there's a possibility you may be prone to hypertrophic scarring. I did try this right here, this scar tape, for a while, but then when my hair started growing in, it didn't stay, so I don't really suggest this one, I don't know, but just wanted to say it because I did purchase it. But this Mederma Advanced Scar Gel is good. I think I started using this probably, no, I didn't start using this. I should have started using this like a month after my incision healed up, because I was going to physical therapy and I noticed a piece back here that was a little thick, and then they would massage it and put some type of cream on it, just the base of it on my neck, because the incision up here where my scalp is wasn't completely healed in yet. And then so I went to my neurosurgeon and asked him, like, okay, so is this a keloid? And he said, looks like it. He sent me to a dermatologist, and she said it was not a keloid, it was hypertrophic scarring, where it's like, I don't even know how to explain it. Like, it's like a keloid, but not. A keloid, I guess, heals also from the inside out and protrudes this way, whereas, don't quote me, whereas the hypertrophic scarring does not heal on the inside, which is great, because I was concerned about my Dura patch and all that. And so it when it heals, it makes extra skin, but it spreads this way instead. And it's kind of wavy, and I'll do a separate video about the hypertrophic scarring. But if you know you're prone to keloids, or when you have a scar, it starts making extra thickness, ask your neurosurgeon about this Mederma Advanced Scar Gel. Because for me, my scar was dry, it turned into the hypertrophic scarring, but this stuff actually right here does work, because you can put like a thin layer on, you can put like a thin layer, there we go, that's a lot, but you can put like a thin layer and rub it on your incision, and it helps it to stay, I guess, supple and moisturized, so it's not dried out, you know. It kind of helps it, and once it dries, you know, it just kind of leaves a little thin layer on there. And for me, when using this, it's not as itchy. I don't have to pull my neck down like this as much, because the hypertrophic scarring, it gets tight. It's like the skin pulls, and I'm already dealing with stuff in the front, so then I have to deal with stuff in the back. So that's kind of crazy. But I suggest, if you know you have skin that's prone to thickness, like for me, I should have known this because I had a C-section, and my C-section, the skin grew so thick. And then when I had another kid, they ended up cutting it off, and then it didn't come back anymore. But instead of a keloid, maybe it was a hypertrophic scarring. So just something to think about in advance. If you know you have skin that makes that extra part right there on scars, and I suggest you look into getting this Mederma Advanced Scar Gel. Lastly but not least, so just to recap some of the things: earplugs for sensitivity, vomit bags for nausea, in addition to the alcohol pads, Mederma Scar Gel, the cups for just in case, the pressure from your head, brushing your teeth, fish oil for appetite, Napolina flakes if you're constipated, because I think I was drinking a lot of prune juice, and but this stuff right here works. Neck pillow, maybe after the first week, or if you have a softer one, then you can probably use it. Talk with your doctor on all this stuff. And then the grabber, this is good even months after the surgery. And then the cabinet stoppers for the sensitivity, and then the alcohol pads to sniff for nausea. So hopefully some of this stuff will help you out, just trying to see what I can do to help others, and do videos about things that really helped me. So this stuff came in handy for me. May work for you, may not. If you have suggestions, you can put them in the comments. One thing I will say is, like I say always, make sure you get your rest, because in order to heal, you need to actually be sleeping and not stressing over things, because it will impact you even 3, 4, 5, 6 months down the line. For me, it did, as far as headaches. So I try now to ensure that I get my rest and don't stress. So yeah, so, and then of course, like I say, the towel that's rolled up to put on your neck, to kind of help you maybe with sleep, because that's what they told me to do in the hospital. So hopefully, if not one of these things, some of these things will help you out in your post-decompression surgery journey. And I'll continue to come out with more videos to try to help you out. You guys take it easy. You got this. You can do it. I know it's scary. I know it's like, ooh, but it's going to get easier. Once you get this done, life for me has gotten easier. I'm able to think more. Like I said, not really issues with tinnitus, not really issues with headaches. That stuff is subsided. Just waiting on some of this other stuff to subside. And I'm very thankful. I'm very happy that I got the surgery. Also for the fact, like I always say, of not becoming paralyzed. So I'm just thankful to God. And you'll do great. You'll do great. So stay positive, find things to make you happy, and enjoy life. Bye, y'all. Hey guys, so today's Chiari conversation is regarding why I chose to have brain surgery. So just a little backstory. I believe I've been dealing with Chiari Malformation my entire life. Some of the things like headaches, nerve issues, and I've dealt with that growing up, in addition to other things. And a few years back, I had some issues with my left hand, trying to hold a towel in the shower. Went to urgent care. They sent me to get an MRI. I went to go see a primary care physician, and the MRI said that I have Chiari Malformation. Had no idea what any of this was, all new to me. So the primary care physician, instead of sending me to a neurologist, he sent me directly to a neurosurgeon. Neurosurgeon talked to me about everything, told me that we can just watch the Chiari. Even though I was having 1,000,001 symptoms, he said we can watch the Chiari, but the main issue that you're having is the fact that you have a syrinx, Syrinx. Hopefully I'm saying that right. He told me that I only had a few nerve fibers left in my spinal canal where my Chiari was sagging. He told me that because the fluid had built up so much so in my spinal canal that I only had a few nerve fibers left. Okay, so only a few nerve fibers left. So basically, he told me that if I did not get the surgery, the brain surgery, that I would eventually become paralyzed from the neck down. And the day I learned that, I literally, by the time I got to my car, because I asked him, I said, so can I just do like can I go to a chiropractor? Is there any other solutions? And he was like, no, the only solution is brain surgery. So when I left my appointment, I got to my car and I literally broke down crying, like literally. It it really did affect me. It literally took me 2 years to actually come to terms. I did tons of research. I was on the computer researching, I was online, and I knew that he was a good surgeon because I was referred to him. But like I say, even for any doctor, I'm going to go do a thorough research. I go look at Google reviews. I look at what people are saying. And yes, he's the best of the best. He was in the local magazine for awesome doctors. But even still, I was like, okay, let me do some research because there's got to be a different way because I did not want to go through surgery. And I just kind of pushed it to the side. Like literally, I would have times where I would just start crying because I felt like nobody understood not just what was going on with me with the Chiari malformation, but no one, was in my position. I'm like, he's saying he's going to, cut my skull, remove a piece, remove C1 and C2 of my spine, replace it with pig skin. And to me, that was super frightening. So I just kind of pushed it to the back burner. My youngest daughter was diagnosed with severe scoliosis. So I focused more on her, getting her together, and did research, but I was just too scared. Every time I thought about it, like it really stressed me out, which added to the Chiari malformation symptoms I already had. So one day my husband was like, now that, we've got, our daughter squared away regarding the scoliosis, because I found her an actual chiropractor that has this awesome boot camp. And initially, I think she was diagnosed with scoliosis that was at 65 degrees, I think it was. Then just with the boot camp, it got down to 54. But, when she first started, she had like a serious hump in her spine, you could tell. But now that she went through the boot camp and she's wearing the brace, it's all getting better. So at any rate, I was really focused on her, just trying to find things to keep busy so I wouldn't worry about myself. And so one day my husband was like, okay, now you need to focus on you. What about your Chiari malformation? And so I think that night I literally could not sleep because I cried all night long because now the reality was back. And so I do know that like I was like, I'm more scared of the surgery than the plethora of issues I have, with the Chiari Malformation, the headaches, the ringing in the ears, it was just crazy. The spasms, the vision issues, balance issues, just stomach issues like tingles and sharp pains. And I have so much stuff going on, but even though I was dealing with that stuff, I felt that paled in comparison to going under the knife and having surgery. So that night, when my husband and I discussed it, I literally broke into tears and could not sleep that night. And so I finally came to terms that I need to go ahead and so once my husband and I had that conversation, I literally could not go to sleep. I cried through the night, and I realized I did have to come to terms with what was said. The neurosurgeon literally said, "You don't have very many nerve fibers left. If you continue, then you will be wheelchair bound." And one thing I remember my daughter saying was, "Well, Mom, that wouldn't be fair. If you're not going to take care of yourself, that's very selfish towards us, because then we'll have to take care of you." And that just also kind of gave me a wake-up call that, okay, let me focus on me. I've got 5 kids, but let me focus on me. So with that, I prayed about it and finally decided to have the surgery. Because I did not want to be wheelchair bound. I did not want my children having to take care of me and bathe me because I could not even move. Like, to me, that just sounds like the scariest thing. And even though, the thought of having surgery compared to all the issues I was having, now that I've actually had the surgery, I'm so glad that I did. I'm going on 6 months now, but I'm just glad that I went through with it, for the simple fact that I no longer have to worry and stress like, okay, when is the day going to come to where my limbs stop working, or, all of a sudden I can't walk anymore. I no longer have to worry about that. I know that I do still have to get MRIs. I think when the 6-month mark comes, I have to get another MRI just to check to ensure that the fluid is flowing like it should be. But yeah, so I decided to have the surgery, and honestly, it wasn't even really my decision. It just wasn't even another option. Like, literally, this was it: either have the surgery or become paralyzed. And yeah, so I got the surgery, and like I say, I think it was the best thing that I could have done. And I got it solely for the issue of the fluid on the spine. But the surgery for the fluid on the spine and the surgery for the Chiari Malformation is the exact same surgery. So he removed, I think he said 3 centimeters by 3 centimeters, and then he moved a portion of the C1 and C2, and then he replaced it with a Durapatch, which is some type of pig skin. So, like I say, I'm going on 6 months, and I actually feel really good. I know I'm rambling, but like I said, I got the surgery for the fluid on the spine, but it's actually helping me with the Chiari because it's the same surgery. Like, for instance, the tinnitus in my ears was absolutely driving me crazy. I could not think. It was so loud in addition to everything else I had going on. And now that I've actually had the surgery, I'm in the healing process. It's not crazy anymore. I literally periodically hear, like even right now, I can hear it. It's just a quiet whisper, which is so much better than the crazy ringing sound that I couldn't even think. I literally couldn't even think. And then regarding the headaches, before the surgery, I was having migraine headaches. I was having cluster headaches that were really bad. And then it would happen, like quick cluster headaches would happen like 5 times in a row. And this was happening often. I was actually taking pain reliever on the regular, you know. So since the surgery, And now that I've healed from all the healing pains, I think maybe the other day I felt just a little bit of pain, but that might have been because sometimes I don't get enough sleep because I need to go to bed. But I have not had to deal with cluster headaches, migraines. It seems like those two, at least those two, have subsided. And so I'm just waiting on, some of the other symptoms, which, like I said before, I think the neurosurgeon said it may take like a year for not everything, but those things that does subside, it may take a year for that to happen. I'm hoping everything subsides, but yeah, so that was the reason why I had to have the surgery. Honestly, if I had not have had the syrinx, I would not have had the surgery. I would have just, and I'm praying that everything heals, but I literally just would have continued to suffer. Because to me, having the surgery was super scary. But now I'm so thankful. I'm so glad I did. I would have done it all over again if I had to, if I'd have known what I know now, especially as I document, the healing process. I wouldn't change it. So it all seems scary, if you have a syrinx or if your condition is so bad that you can't cope daily. You're having migraine headaches, you're vomiting, you're having major vision issues, because, as we know, all the symptoms are different for everybody. But if it's so bad that, it's too hard for you to cope, like at work or just, in daily life, and your neurosurgeon is giving you the option to do the surgery. I'm not pushing anything. I'm just saying you have to just weigh your options. Do you want to continue to live like this? Is this something that you can deal with on the regular, like taking medications? If you can deal with that, then okay, but I know I've heard of so many people who have it really bad and they're looking like, no, let's get this surgery, so on my page, I just have a lot of information. I decided to just document my journey, with Chiari Malformation, through the surgery process. And on my page, on my playlist, I've got a ton of videos, just showing the process when I went in the hospital, what my incision looks like, the healing process. I think I've got one where I've got 3 months worth of incision healing, and I'll talk about this in another video, but I ended up getting hypertrophic scarring because I should have used a scar gel. Scar gel, like Moderna scar gel to stop the excess collagen. And I'll show you guys that real fast. Like I say, I am about a little over 5 months. But I'll show you this. But I suggest if you do go through with the surgery, make sure you're paying attention to your incision, because I thought it was a keloid, but it wasn't. But it started to get really thick and itchy, and even now, almost 6 months in, the skin is so thick to where, like, if I lay down for a nap, I literally have to take my head and pull it down like this because the skin pulls, it's dry. And I went to the dermatologist, and that's how I found out that it was hypertrophic scarring. And she said it doesn't heal from the inside, it only makes skin from the outside, which was great. And she said that if I wanted to, the only solution would be to get steroids, and that would be like 10 needles going in my head at a time, multiple times throughout a time frame to stop the growth of the keloid. I'm sorry, not the keloid, the hypertrophic scarring. But she did say after 1 year that the growth will stop. So I guess that's good. I'm just hoping that it doesn't grow anymore. So what I've been doing is just kind of massaging it and, keeping it, the gel on it or some type of lubrication so that it can stay moist and not be itchy and dry. But I'll show you guys that real fast. So here, the hypertrophic scarring, it's almost like a wave where it's thick and then there's nothing and then it's thick again and then all the way down to here. So it's super dry. And like I say, I always have to do like this to stretch it because it just is dry and it's something else you don't want to deal with. So I think I'm kind of wrapping this up. But yeah, so that's why I had to do the decompression surgery, and I'm glad I did. So I've got a few more videos coming up for you guys, explanations of things that I've been going through, tips for some of the symptoms. And yeah, so if you guys like this video, please like, share, and subscribe. And just praying that everyone does well on their journey, and keep your head up. I know it's hard. Even though I've had the surgery, I still have the symptoms. So I'm still dealing with it just like you are. So keep your head up, pray, literally find things to do to make you happy. Don't consume yourself with worry. Just try to live life the best you can, because we're all going through the same thing, but on a different level. Everybody's got different symptoms, but we're all basically in the same boat trying to figure this thing out. So just make sure you keep your head up and continue to move forward as we all try to grow and learn about this Chiari malformation thing. Thank you guys. Have a great night.